Okay, as promised, here is sort of a mini version, a mini recoup, if you will, of the lecture that we presented today. And I apologize, it was not ready ahead of time, but remember that all of the content comes from your readings. If you use your learning style and skim it, and you've also had advantage of having ATI open since September 8th to help layer this information in, you should be prepared when it comes time for lecture. So don't come to class cold. Please review and know that that's going to help you to understand this the best way, because it is a lot of information. Okay, so we're going to go through this in an abbreviated version. And then I did post some announcements regarding the quizzes and tests and things, again, which have been addressed multiple times on Blackboard. So remember that the nursing theory basics are saying that we're going to take a broader look at what is involved with nursing, and that everything that the theory is about and how nursing describes the theory or lists the theory in your book talks about achieving outcomes, so that in the end we're using the knowledge and judgment and all of the components under the umbrella, as we discussed, to help define what nursing is and how we practice. It's going to define the nursing actions that we take. So that sort of reinforces all of the cues and competencies and knowledge, skills, and attitudes, and so forth. And none of that should sound very foreign to you when you've been in and out of those modules. So if you're not viewing those, you need to go back and do that. The theories also allow us to kind of keep evaluating our practice through the use of collecting information, which we said was informatics, following up and auditing certain things like QI, and we use many examples in class to explain that, as well as evidence-based practice. So it's a continuous cycle that, you remember the goal, we talked about the goal and the aims of nursing, and it's a lot about outcomes. It still goes back to safety, patient-centered care, and critical thinking. But looking at that continuously helps give us the assurity that we're using those care standards and we're not missing anything as we move forward with our profession. And then these aims come directly from your book and are supported by the American Nurses Association. And when you think about the comprehensive thinking that nursing is, comprehensive practice that nursing is, we want to make sure that we're looking at not just the person we're treating in that setting, wherever it is, but looking at all populations. So promoting health, preventing illness, restoring health, and allowing for coping is helping us to do all that. So if you think about what you've already learned, we promote health in some ways just by patient education, the nurse to the patient, educating them. We're promoting health by making sure we do our procedures properly and use PPEs and all of that. We're preventing illness by reaching out to the public, by using advocacy from ANA, and we talked about the Institute of Medicine, which now has the name change, National Academies of Sciences, Engineering, and Medicine. And we advocate in many different ways for our patients, no matter where we practice and how we practice. And then finally, if we understand what a theory is, we have to know what makes up the theory. So you can kind of think of it as sort of a trickle down type of thing. From the theory and all of its components come the structure and organization that allows us to best use the knowledge and judgment, and then take it even a step deeper and say, okay, we use knowledge and judgment through using teamwork and collaboration, evidence-based practice, safety, leadership, priority setting. So it goes back to the helix. So all of this material is kind of blending in together, but it's for the purpose of maintaining standards in the profession. And then the benefits of theory are what we talked about in class. So this is actually also from your text. Think of what theory does. It brings everything together. It not only gives a common bond to nurses, but it helps provide for some structure as we care for our patients, which is not always easy to do depending on what's happening and so forth. So just take a look at the list, but go back to your readings. This list and everything I'm saying is not going to mean things unless you go back to the reading and review it and bring it all together yourself. Being an active and engaged learner is how you're going to be successful in nursing. So that's what you need to be doing. And finally, the concept map just explains the concept a little differently. Well, not differently, in a different way, because it's more pictorial, and that's good. Okay, a lot of us learn that way, and using those connecting phrases, or what in your book talked about theories and propositions, propositional phrases, whatever, however you want to think of them, help you to connect the concepts. So when you think of a theory, just like when you think of the umbrella and you make a quick connection to Cusin and the helix, you should look at theory and make a quick connection that, okay, a theory is all about the concepts that make that theory work. It allows us to enact it. It allows us to make it part of nursing and maintaining the standards. And then finally, the 4 common concepts in every nursing theory are person, environment, health, and nursing. And this is where I may skip over a bit because your books do address the theorists quite nicely. And even though I could reiterate everything we said, you have to take it back into the context of those 4 components. And that is greatly done and very well done in Masters. So take a look at that. And as you're looking at that, compare and contrast the different theorists and what they stood for, how they brought their values and beliefs to their particular theory. And then finally, non-nursing theory contributions, which directly affect care. Remember, nursing is very comprehensive. Nursing knowledge and foundational nursing knowledge encompasses a lot of different disciplines that eventually help us to practice in a comprehensive manner. So that's where these gentlemen have entered the picture. And Abraham Maslow is the first one. And remember, he said that basically we want to imagine, well, not imagine, we want to have a patient realize their actual potential and self-actualization, being happy with who they are, understanding all that. And that is well done in your Taylor. And so we have to start with the physiologic phase. You can kind of think of it as steps. If this picture doesn't do much for you, which it doesn't always do much for me, I picture it as steps. So in other words, you're standing on the first step, and if your physiologic needs are not met, and those are basically life-sustaining, homeostatic, balancing type of things, you need to move, you can't move to the next step of safety and security. So part of what makes you whole, or anybody whole, is getting the physiologic pieces down. So is there homeostatic balance in your body as it functions? Once that happens, you can move up to be aware of safety and security and incorporate it into your, into your world, and all the rest of them sequentially. So when we talked in class, we said there's a lot of comparison and contrast here we can make with nursing theory. Some of what Abraham Maslow did maybe happened at the time that some nursing theories were kind of coming into place too, but it doesn't allow for sort of the evolution of healthcare in some ways, and the evolution of client care in different nursing care settings, and the chronic diseases that people are living with, and many other different pieces of information that we have today. So think of it as it is important in some ways because it makes us think about what every patient needs, but we can also accomplish that by using the nursing theories comprehensively. And then Erickson is more focused on growth and development, and that's sort of why he's included, even if you're not totally sure how applicable this is. You have to think about ages across the lifespan, and that we teach everybody, and even if they're not directly our patients, if you're teaching a mom, for instance, and she has 3 children, you have to include and factor in that she is a mother. She's not just a patient with an illness, she is a mother, and how does that affect her perception and her coping and everything else that we've embodied and talked about with these theorists and what they've said. So that should make sense a little bit there. And addressing all the components means we take them back to what we have learned so far. Okay, so you're on the pathway and we looked into the fog and we know it's dissipating. You also have to turn around and look back often and think about, what have I learned so far to get me to this point in understanding this framework? So we kind of zoomed in on the patient and zoomed in on some of those competencies to help you understand them because they were introduced in the ATI modules. I wanted to lay the groundwork, because if you start talking about things and not understanding those basic pieces, people would be lost. All right. So then the frameworks, not framework, I keep looking at that word on this slide here. So it takes us back now from a theory perspective. How do we look down and kind of have a more global view? So when we consider the person in a nursing theory, which again, then it extends into our nursing care, we know we have to use frameworks in order to problem solve, evaluate, and follow up on patient problems. Okay, environment is not just the localized small environment like a patient's hospital room or their home or wherever we're providing care. The environment relates to the care models and the setting, the whole building. What's the ventilation like? What's the temperature like? What's the setup like in terms of safety? So these are just some examples. I'm sure your book and your readings have more. It was just a matter of coming up with something that you could put a perspective on yourself and kind of wrap your head around. Is like, well, how do we go from a mini focus to out? So remember that whole mission moment about the big picture. There is so much that we have to think about when we're taking care of patients. And finally, and then health is not just about curing disease or helping to manage people manage diseases, but giving them that homeostatic balance that we even talked about with Maslow and a lot of the other theorists. And then nursing, in order to get all this to work, we have to take both the global view and the more focused view. Because globally, we know that even though we're managers of care, we have many collaborators now on the scene from different disciplines like physicians and many other disciplines to help us to give complete and comprehensive safe care using critical thinking and making it patient-centered. So that means using some priority setting and also remembering the knowledge, skills, and attitude. So everything that the ATI has mentioned, everything that we're mentioning has something of value to bring. And then we talked a little bit about nursing philosophy, which we'll address again, but basically you need to start exploring your beliefs, values, and ethics. And when we talked about each of the theorists, we spoke about what types of things that they embodied, meaning their ideas, their values, and their perceptions that they brought with them to their theory. Because you can't kind of separate yourself out from your practice. And that's going to help us to complete that assignment later on.